Citizens Advice County Durham now offers a service called Healthier and Wealthier to all GP practices throughout County Durham. We offer free, impartial and independent advice to GP patients so that we can help GP practices with some of the pressures they face. You might have noticed that more and more patients are heading to your practice asking about social matters like benefits, housing, stresses like work and money, or simply to ask a doctor to provide evidence. Unfortunately, this is likely to increase for the foreseeable future. Right now, the job and skills market in the Northeast is still challenging. A lot of people rely on benefits and tax credits, and the region as a whole is very sensitive to changes in public sector services and benefits policy. We're already in the midst of significant changes in the benefits system, and the general trend is to make fewer people eligible and less money available. On top of this, services in the public sector and charity voluntary sectors are facing severe funding challenges, and the amount of support that people can find is generally reducing. Unfortunately, this means that any change in social care seems to be shifting the burden onto the health services that are already stretched. The benefits cap reduced some households' income but also prompted some patients to make new claims for disability benefits, hoping to get around the benefits cap itself. Many people have been forced to change from disability living allowance to personal independence payments, which has much tighter criteria. This meant, of course, that some people's benefits were stopped or changed. And universal credits will begin rolling out across the county from October. This will force some existing benefits onto a new system, a process which could take 6 to 7 weeks or more for some patients and leave some patients with no money at all during that transition. It doesn't take a public health expert to realize that all of this will create more hardship, greater mental health problems, and worsening physical health for patients. Some patients will simply suffer in silence and may be forced to choose between heating or eating. Some patients will lean heavily on family or friends, or get into dodgy debt that could make their problems a lot worse. We know that patients' mental health is likely to deteriorate in these circumstances. And of course, with worsening mental health comes worsening physical health. Not only are they likely to stop their normal activities, but they'll also stop eating properly and switch the heating off to save a few pennies. So what does that mean in County Durham? Well, we have some appalling statistics in life expectancy, suicide rates, health and public health indicators and social problems compared with the England averages. Durham Food Banks recently reported that the biggest increase in their usage actually comes from people who go to work. So where do patients go when they become desperate and these problems begin to niggle at their health? Probably the GP practice. This is where Healthier and Wealthier can step in and save you some time and work and get the very best outcome for your patients. If we can solve some of their problems, they're less likely to need medical help in the future. This of course means fewer people suffering with stress, anxiety, mental health problems and problems at home and work. And if you do need to see patients about these problems, you've got expert help at the end of the phone line. And after giving advice, we can even pass patients on to over 100 other organisations locally who can provide more specialist and long-term support. So how does it work? Well, it's easy. It has to be for a busy GP practice. Anybody in the practice, from reception to the GPs themselves, can make the referral. Once you've spotted the need for advice, you use a dedicated hotline from Monday to Friday to request an advice call for your patient. This process only takes you about 30 seconds because all we really need is the patient's name, number, and what time they'd like their call. And after that, we do the rest. It's free. We call the patient so it doesn't show on their phone bill, and they don't even have to leave their home or use an appointment at the practice to get the advice. It's the quickest way to get expert advice. Our callbacks are usually on the same day. What's more, there's also a number for patients to call us directly if they've used us before. This means they don't even need to approach the practice when they want us in future, and we become the first port of call for all of these non-medical matters. The range of advice we can offer is enormous, and because we're impartial, we'll help patients no matter what other service they already use, and there's no eligibility criteria. We'll involve other services if we think that's best for the patient. One of the important ways we can help a GP practice to reduce their workload is to advise patients on when they do or don't need medical evidence to support their benefits applications and appeals. We're not medical experts, so we can't provide evidence ourselves, but we can tell patients what might be the most appropriate form of evidence for the stage they're at. It isn't always medical evidence from the doctor. And when they really do need medical evidence from you, we'll advise them only to ask you for things that will support their application and the care and support needs they've identified when they've spoken with us. And with our ability to refer to over 100 other organisations, you really are getting a lot from your 30-second referral to us. So you might find 3 scenarios at your practice. The patient might present a non-medical matter and you can refer them straight to us without needing an appointment with yourselves. The patient might not present a non-medical need, but through the booking process, a receptionist or secretary could perhaps identify that it's a non-medical matter and make the referral themselves. That would save you a clinical appointment. Or of course you might be treating somebody for stress and anxiety or other illnesses that result from not having the means to live a healthy life. So what's the service actually achieving for patients so far? Well, patients with a financial outcome have increased their annual income by over £5,000 each on average. That's enough to heat a home for 3 years. 84% of patients report an improvement in their mental health and well-being, and over 40% say that translates as an improvement in their physical health too. And significantly, some of the Warwick-Edinburgh mental well-being outcomes that we record show that patients are better able to care for themselves. This of course means they're less likely to trouble the doctor's surgery when they have a non-medical matter. So what's going on? Why does it work so well? One key factor is the speed with which you can refer as a practice and how quickly the patient gets their expert advice. Another important aspect is that we can give patients lots of time and actually tackle the root cause of many of their problems, so they're less likely to get into a cycle of debt, poor health, and come into the GP practice. Referring to other agencies doesn't hurt too, because they can provide longer-term, specialist and in-depth support which follows on nicely from what we do. So what's not to like? It's quick and easy to use. We become the first port of call. Your patients are better able to care for themselves and find support, and you can focus on clinical care. All of this means reduced demand for your practice. Healthier and Wealthier is funded by Durham County Council's Public Health Department with a contract until at least 2020. The earliest form of the service was first funded 15 years ago by the NHS, so you know that it's here for you and your patients. Thank you for watching. If you have any questions about Healthier and Wealthier or would like us to visit your practice and explain the service more fully, please call us on 0191 372 6697. Thank you.